Hi, welcome to Tipsy Tooth Talk.
Or T cubed, because I can't say it.
We're back for another episode. Today we're going to talk about a watermelon drink and lasers, right?
Yes.
Sweet.
Watermelon and lasers, right? That they're right next to each other in the dictionary. Okay, so let's start with the watermelon drink first. This is a watermelon lime cooler, and it's made with vodka. And so what I have done is, all right, listen, I've cheated a little bit. If you are fortunate enough to live in Texas and you're south of Dallas and you have an HEB, it's already made for you, basically. So I got the tub. It calls for watermelon. So you need cubed seedless watermelon.
I'm going to get the example.
Yes. You can get that at your HEB. It's already like in a tub. It's already cut up for you. If you don't got an HEB, I'm sorry, go cut some watermelon. Okay. So I took 2.5 cups of cubed seedless watermelon and I blended it in the blender, and I did not do that on camera because, you know, noise. And then what I did was I took the blended watermelon and I strained it off because there was a lot of pulp. I just thought watermelon would just blend up into juice. It does not. It has a lot of pulp. Like, actually, look. Here you go. Pulp. Huh? Okay, so I strained that off, and now we're left with our the right amount of watermelon juice. And to that, again, cheating, you need...
Wow, you're cheating a lot today.
I know. Look, it's been a long week, y'all. Okay, so lime juice. You need 4 ounces of lime juice. Now, you could go squeeze your little limes, or you could go to HEB and buy the jar, the little thing of already squeezed. Like, this is 100% lime juice. Like, they squeezed all those limes for us, folks. Okay, so
I've never even thought about buying that.
Really?
I sit with my Pampered Chef little juicer. And,
oh,
yeah.
yes, no. Okay, so 4 ounces of lime juice. Woo! You were today old when you learned that HEB would do that for you. And then, of course, our simple syrup again that we've used in the past. You need 4 teaspoons of that, and I pre-measured that because in the past we've had to, because we didn't have our glasses on. So 4 teaspoons of that. And now we're going to use a little Tito's vodka because, again, we're in Texas. Don't hate us because we have all this great stuff. Just move here.
Come visit.
Come visit. All right, now this actually calls for 8 ounces of vodka.
Holy.
So this makes more than 2 drinks, y'all. We're not going to drink all of this
right
now
now
on camera. Okay, so
I was going to say, yeah, we probably will,
but not on camera. Okay, so there's our 8 ounces of vodka. Now we're going to give that. So okay, so we've had watermelon, lime juice, simple syrup, vodka, 4 ingredients. We're going to give that a little stirry. Now in the recipe it says you should blend it, but again, for the sake of not turning on a blender while we're on camera. Although I feel like those cooking shows always do that. How do they must,
just stop talking for a second.
Well, they must have like some sound mitigation or something that we don't have.
Oh.
You know, their test kitchen is probably fancier than ours. So, okay, I'm giving that a little stir. So, Carlin, if you want to pour that over. So, we're just it's a little summertime in Texas. We've got our mason jars. We're going to pour that right over the ice.
Makes me want to sing that summertime song by Kenny Chesney, but I won't.
Okay, good.
That's not anything that way.
No, I don't.
Well, I'm gonna have to leave you guessing.
Okay. Now, so the lime juice that I added to that was like your regular limes, like the big limes. I grabbed a few little key limes because I just like how sweet they are. So I'm gonna give that an extra little squirt in there, and we'll use our straws. We've got a little garnish.
Oh, look at you.
Key lime and watermelon, and we'll give that a little stir.
It's pretty.
See, but look how simple that was. Especially if you could cheat.
Cheers
to beautiful smiles. All right, let's try. Because I did not pre-test this, just so you know. So you may see a big fake smile here in just a second. Oh, no fakeness.
It's good. It's got a little tartness.
Yes, it's tart.
Yeah.
You may want to add a little more simple syrup.
Tartness, is that right?
It's the lime for sure. But I do like the watermelon in it.
Mm-hmm.
All right. Oh, I like that. That might be my new
go-to.
Yeah, nice little patio refresher. You know, sitting out back.
I told you I had an Empress 75 last night.
Oh, those were good. Remember those from last week?
So see, we're like making our drinks and then going places and asking other people to make them.
Yes. All right, so I'm going to slide this over just a little so that we can bring this in. Like we can't get lime juice on the laser, y'all. Okay, so let's talk a little bit about laser dentistry and why would we be using a laser in dentistry. Well, lasers are kind of replacing the scalpel these days. And so there's many uses, you know, in the past, if we've had like to do a frenectomy, where you have that little piece of tissue underneath your lip there that's kind of keeping your lip down, they would go in and cut that. If your gums are uneven, they would go in and cut that and even that out. If you've got tissue over your wisdom teeth or a tooth that didn't quite come in all the way, you can cut that off. Well, you can cut that off with a scalpel, but then you've got some bleeding issues. It takes longer to heal. So the beauty of the laser is it goes in, makes a nice clean cut, cauterizes or stops the bleeding process. So it's a really nice adjunct to anybody's practice. So we just acquired this one in our office, the Gemini laser. And did she go to sleep on me? There we go. Now, what I love about the Gemini is, one, she talks. We have named her Larissa the Laser in our office. So Larissa talks. And Larissa was clearly designed by a woman because she gets charged, right? You can plug her in and use her, or you can just charge her and use her. And she, if she begins to run low on battery, she's going to tell you, battery running low. And a few minutes later, battery running low. And then for her final, you know, insult to injury, just before she shuts off, she says, I told you so. So kudos. I don't know who designed this, but I love you because it makes me giggle. Okay. So
Really? That's hilarious.
Yeah. Okay. So we've got a little, like, I feel like it's a heads-up display, like an F-16 fighter or something. It's kind of cool. So lots of things we can do, general dentistry-wise, gingivectomies, taking off, you know, sometimes people get little things that have to be biopsied. You can do that. Another really cool thing is how many people have canker sores or aphthous ulcers, right? And you get the Abreva or you get the, you know, whatever you put on there when you first begin to get the tingle or whatever. Well, guess what? If your dentist has a laser, then when you begin to feel that tingle, or even after it's already erupted, come in, because we can go over that with the laser. And so, and it goes away within minutes. Now, the lesion doesn't go away, but the pain goes away and it heals a whole lot quicker. So, two different ways that this can be used. It can be used as a cutting laser. I don't have a cutting tip on here right now.
It's probably a good idea.
Yeah, probably so.
Considering
drinks. Or a non-cutting tip. And the non-cutting tips is what you would use for things like the aphthous ulcers, the canker sores, that type of thing. Or in our office, what our hygienists use it for is our gum disease or periodontal patients, because the laser can go right along the gum line and it'll reduce the bacterial load that's below your gums. So in general, in a periodontal patient, you probably have like 1 billion, I'm not exaggerating on that, 1 billion, you know, bacterial counts along your tissue. They go along and they do laser bacterial reduction along with your cleaning, and we will reduce that bacterial load to like hundreds for about the next 4 to 6 weeks. So it's very useful in our hygiene department to keep bacterial loads down, to stop that periodontal disease and that bone loss that so many adults these days have. Uses for kids too, frenectomies.
Mm-hmm. So I get a lot of referrals for patients that are tongue-tied and some lip ties too. And, you know, I've been a dentist for 22 years, so I've mostly been using blades. I have a laser, this is called a diode laser. I have a diode laser in my office, and but I'm getting ready to get a one of the big, like, I wouldn't be able to bring it here because it's on wheels, like, and
on roids.
Maybe one day we'll film at the office and we'll show it. But I'm getting a CO2 laser So, which is a little bit different. But when I'm working on babies, and I'm using, mine would be almost entirely for cutting purposes.
Right.
It's a little faster.
Right.
And so, it doesn't, I really want to be super quick, because I'm talking babies like days, weeks old.
Right.
And so, that's probably what we're going to be doing at my office in the coming weeks or months.
Cool.
It's in the process. So we'll do a special thing on that one later, and we'll talk more about the use of lasers in children.
Yeah. Live from Blume Pediatrics.
Yeah. We'll have to, and I promise we'll make our cocktail, but like not with patients in the building.
Oh yeah, no. Days off. This is all happening on days off, y'all. Always. Okay, so one of the big things with lasers too is that you must always use laser-specific eyewear.
Ooh, tell me how I look.
Yeah, you look cool.
Is that good?
Yeah. So our diode laser in our office operates between 810 and 980 wavelength. It pulses. So these glasses are specifically made for that wavelength. So every laser has different glasses. Okay, so super important that you're wearing those glasses.
Awesome.
Because lasers can scatter, and so even though you may not be looking directly at it, you could still have eye damage. So as a patient, they should be on you. As a clinician, they should be on you. Even your assistant, anybody that's in that room should have glasses on. You should not have extra people in that room. So if you come and you've got like a kiddo with you, or if you've got your kid and there's a parent in the room, everybody should have eyewear on. Super important. So let's just look at, I'm going to move this over. I've got to lean over here, sorry. So we're going to go down. I can't see. There we go. So let's just say we're going to do an aphthous ulcer.
Aphthous ulcer active.
So the other nice thing is that our little tip lights up here, so when we're in the mouth, we can actually see a little bit better. So I'm going to use our lime here.
Oh, good. I thought you were getting ready to do it to me. I was like, oh.
So we have our light, we have our point. It's probably hard for you guys to see on camera, but we've got a little pointing tip. So we're just going to go over, for instance, if we had an aphthous ulcer, and it's taking out that bacterial load, it's taking out what's causing that virus. And so you can see, but it's not cutting this. Okay, so again, I have a non-cutting tip, and I'm in a non-cutting setting. And the nice thing is that this Gemini laser does all the settings for me, depending on what I want to do.
Mm-hmm.
Okay, so there's an example of that. Now the other nice thing, let me put this in standby,
810 standby,
is that this laser also has so this screws off, and this laser has a pain relief mode, and we have a different attachment for that.
That we are doing on me.
Oh, for sure. I did it on me last night. So in our 810 wavelength, we can scroll down to our pain relief mode.
pain relief active,
So why would we use the pain relief mode? People come in with joint problems all the time. They get locked open, they've been clenching, they've been grinding. During this pandemic, holy cow, we're all stressed out, and we're taking it out on our teeth, and we're clenching and we're grinding, and it's causing tremendous joint pain. So the laser can actually, because again, non-cutting, can be used against the joint, up against the muscles that are causing the pain in the joint. So you come in locked open, we've got to get that jaw back in position. We're having some pain or tenderness in the muscles and in the joint. So we can use this attachment to try and give you some relief. So this goes in 30-second increments. And this actually goes, and I can set it to whatever. So I'm just gonna set it for sake of filming. I was trying to get an even number, but it's in 3. So, all right. So
I have been clenching.
Yes.
And I can feel it right here.
So I'm just gonna place this right here. Hang on, I gotta find my foot pedal. There we go. Put this right here. Do you feel anything warm?
Not really.
Okay.
Mm-hmm.
I have to say I can't use this without going lasers.
Okay.
Okay.
Well, that does feel a little different from the other side.
Yeah. So usually
Weird.
in the office, we would do a series of, 30-second increments. We'd probably do up to 90 or 120 seconds on each joint to try and give some relief there.
Pain relief. Active.
Am I good to take off my
Yes.
Stand
I
by.
just
super hot goggles?
Yes, I just turned it to standby, so now we are all safe to remove our safety eyewear.
Now that's bright.
I know. It's like sunglasses. So, just a great adjunct to anybody's practice. So if your dentist has one and they're talking to you about using the laser during your cleaning, I would say yes, because it great results. I had a teenager last week that came in. So teenagers are kind of notorious for not having the greatest hygiene, and we took before and after photos and showed mom what it looked like before. My hygienist went through and did some LBR or laser bacterial reduction on her. And while the tissue was still red, because obviously it's not instantaneous, just the look and the texture of the tissue was already so much better. Like even the teen was like, oh, wow. So great uses. Dentistry has come a long way. It's just been a wonderful addition to the practice, and we've just seen, more importantly, we've seen some really good results for our patients in all kinds of things. Even there's a setting for orthodontics. So if your kiddo's in braces and say the orthodontist needs a tooth exposed a little more to put a bracket on, well, rather than go in and reduce that with a scalpel, we can go in with a laser. And the other nice thing with this tip is, again, it has a red pointing thing, light, so we know exactly where we're going when we're cutting there. So
That's awesome.
yeah, so lasers, Larissa the laser.
Very nice. And I will attest to that they're just absolutely fantastic tools, and they're affordable for you to use. So don't be super nervous that, oh well, if I go and somebody has this like fancy laser, that
Right.
it's going to be just astronomical, because in most cases it's not. Of course, what you're using it for varies
Right.
for what the cost might be, but it is reasonable, and
Yes.
so it is something that we would want to be accessible to people so that they could get the benefit from it.
Absolutely. Ask your dentist about it, and find out if it's something that they're able to utilize for you.
Oh,
It's been good. So, lasers, watermelon cocktails.
woo-woo. Well, thanks everybody for showing up for another episode of Tootsie Tooth Talk.
Yeah.
Cheers to beautiful smiles. Have a good one.